Hi, everyone, and welcome to this February session of Healthy Discussions. Before we get started, I have just a few housekeeping notes. The chat box and Q&A feature are both open, so please feel free to use them. You can turn on subtitles, which are auto-generated by clicking the CC button on the bottom left of your screen. And also, this session is being recorded and will be posted to Quality Care NL's YouTube channel. So Healthy Discussions is a new webinar series launched by Quality Care NL, where we have quality conversations about health, healthcare, and social systems in Newfoundland and Labrador. Our goal is to engage with you on these topics with the aim of continuing public conversations during the ongoing process of health transformation in our province. Public discussion also contributes to the growth of a learning health and social system in Newfoundland and Labrador. On the screen right now, you can see a definition of a learning health and social system as defined by Health Accord NL in its task force report. This definition might seem complicated the first time you read it, but what it really boils down to is the health and social system that continuously improves the culture of best practice, evaluation, equity, openness, and collaboration. The system learns and gets better, resulting in better care and health for all. Part of the definition states that individuals and families are active participants in all elements. By engaging in sessions like this one, by being an active participant in your own health care and wellness, by talking about and acting on issues that impact us as a society, you are contributing to a learning health and social system in our province. So today's session is on food insecurity, and we are delighted to have two guests joining us. Josh Smee, the CEO of Food First NL, and Catherine Drodge, professional speaker and advocate for social justice and people who live in poverty. Joining Josh and Catherine for a chat on food insecurity is Kathleen Mather, a research policy analyst here at Quality Care NL. Kathleen has some questions for Josh and Catherine to get our conversation started, but we will be taking questions from the audience. So please type your questions in the Q&A box, which is a little easier for us to manage. Sometimes questions can get lost in the chat as people chime in with their own thoughts. Since today's discussion is being recorded, you may wish to ask your question anonymously, which you can do by using the Q&A instead of the chat. So without further ado, I'm going to hand it over to Kathleen.
All right, thanks, Kathleen. Robert. Really excited to be here today and to chat with you, Catherine and Josh. So maybe we'll start off with a little bit of a definition. So I'm wondering if you can explain what we mean when we use the term food insecurity, and perhaps how that differs from the terms food security or food self-sufficiency.
Sure, that's a good question. And this is something that comes up a lot in these conversations, right? Because I think particularly here in Newfoundland and Labrador, when people start talking about food security, the place people's minds often go first is, when you go down to the store and the boat hasn't got in and the shelves are looking empty at the grocery store. And so that's, I think, one of the lived experiences that people have that connects them to thinking about food security, but it's really not necessarily that indicative of what's actually going on. So if you want to lay it out, we have a few terms in the mix, right? So food security, the sort of UN definition here is when all people at all times have physical, social, economic access to sufficient, safe, and nutritious food that meets their food preferences and dietary needs for an active and healthy life. So that's a mouthful. It's actually a pretty transformative ideal. Like when you think about what would need to be true for that to be true, what it isn't, but sometimes gets confused with, is food self-sufficiency, which is, in our context in Newfoundland and Labrador, we talk about self-sufficiency quite a bit. How much of the food that we're consuming within our province is produced within this province, and how much is coming in from outside. And so food self-sufficiency is its own issue, but is not directly connected with any one individual person's food security per se. There's some intermix there, of course, because when you think about what people's food preferences are, what people's dietary needs are, there are some connections with food produced locally. I think that's especially true for Indigenous folks, for example. So access to hunted and gathered foods. That does matter, but they're not the same thing. And sometimes, though less often these days, they get switched in the discourse, right? And then there is food insecurity as a term, and that's what we're going to talk about lots today. And food insecurity is a bit simpler to explain. It is the inadequate or insecure access to food due to financial constraints. And so that's a household level conversation about how people can access the food that they need.
Perfect. And so I think that maybe you had a couple slides. I don't know if this is a good time to share those.
Sure. Yeah, I'll do that. And I think just to kind of set the stage, and we're mostly going to have a chat today, but I do have some stats and some framing that will maybe help folks understand kind of what food insecurity in particular looks like in the province. So let me just grab that 1 second. Let's see now. Let me just try. Sorry, WebEx's share function is always a little bit different than mine here now. Okay, we should have it. How's that now?
It looks like it's coming. Yep, I can see it.
All right, there we go. Yeah, so we've talked a little bit about the definitions piece there. One thing I didn't mention, I think I'll just go back to briefly, is that within food, the conversation about food insecurity, there's 3 levels, right? So we talk about folks who are marginal, moderate, or severely food insecure. So if you're looking at what marginal food insecurity looks like, that's folks who are worried about running out of food and limited food selection. You get to moderate food insecurity, which is where you're making compromises in the quality or the quantity of food that you're consuming. And then at severe food insecurity, you're missing meals, you're reducing food intake, you're going days without food at the most extreme end of that. So those are the kind of, when we talk about the top level number of how many folks are food insecure, it includes all 3 of those. And I really think it's important to talk about them together because folks move between those categories, right? You know, someone who is marginally food insecure today is 1 flat tire away from being moderately food insecure, right? You know, there's a lot of potential for shifting, and so I think it's best understood in that kind of aggregate way. The other thing to note, the other piece of language that we sometimes hear in this conversation, and one that our organization, Food First, is trying to center more, is the right to food. That there is a right to food embedded within international law that we are signatory to. I'm not going to read the big long definition off here from the screen, but just to say that this is a right that is not generally realized in Canada, but is an important lens to understand food security and food insecurity from. So yeah, just to give folks a quick snapshot, what does this look like in Newfoundland and Labrador right now? Most of these stats are from the great work done by Proof. I see Dr. Tarasuk on the call, so thank you, Dr. Tarasuk, for always keeping us in numbers here. So the top line number, and this is one that many people have seen, is that 17.9%. So almost 1 in 5 people in this province in 2021 were food insecure in one of those three categories within it. And we need to think about the fact that this is not something that's equally distributed. So we don't have these stats provincially, but we know that there are folks who have intersecting marginalizations who are much more likely to be food insecure than, for example, someone like me, you know, cisgender white guy. If you're nationally, Indigenous people, for example, have a food insecurity rate of over 30%. And then for female lone parent households, it gets up to 38%. So I think we can understand why that is. Obviously, that female lone parent households have a combination of higher costs at one side and lower income at the other. But it's really makes you realize that within that number of 17.9% for the province, there are some folks who are disproportionately impacted. And that would also include folks with disabilities, right? So folks whose disability prevents them from engaging with the labor market are often relying on really inadequate social supports to support their access to food. We also, unfortunately, have in this province the highest share of children living in food insecure households of any of the 10 provinces. So about a quarter of the kids in this province are growing up in a food insecure household right now. And that is a tremendous challenge from a health perspective, from an expenditure perspective, I think from a moral and an ethical perspective as well, right? And it's a pretty shocking number, I think, to see. The other piece, of course, is that because we know that food insecurity is so closely connected to it's largely a matter of income, and we also, I think, anyone who's on this call who is relying right now or has relied on social assistance in this province knows that social assistance is an extraordinarily low level of financial support. You live below the deep poverty line right now if you live on social assistance. And so it's no surprise that almost 70% of households that are relying on social assistance are food insecure. We also know, and this will come up, I think, as we chat today, that food charity is a really often framed as the response to this, right? So food banks, meal programs, those kinds of things. But it is really remarkable how few households are accessing food charity. So depending on the study and the time frame, 7 to 20% of folks who are food insecure at a given time might be accessing a food charity service. The rest of the food insecure population are getting support in other ways. They're, leaning on family and friends, for example, leaning on those informal support systems to access food, compromising in other parts of their life and cutting costs elsewhere. There's lots of other things people do, but sometimes we think about food insecurity primarily through the lens of food charity, and I think that minimizes the problem in lots of ways and frames it in a way that's not all that helpful. So it's good to remember that there's this iceberg of food insecurity, and we're only ever seeing the tip of it in the food charity space in this province or anywhere else. The other dominant, I'm almost done with the statistics parade here, but just again, the other thing I think that dominates this conversation right now is food prices, right? We're all feeling this, that food prices are consistently outpacing inflation in other areas. So as we're seeing inflation ease off elsewhere, we're still seeing huge food price inflation. And this is especially relevant to folks who are relying on social benefit programs. So if you rely on income support, for example, your income support is not indexed to inflation. So this is an 11% cut in your food budget, right? And so this has been really catastrophic for a lot of people in this province over the last year. And I'll say where we have connection to frontline services ourselves at Food First, it is certainly far worse now than it ever was during any time of the kind of pandemic lockdown periods. And it's driven by this increase in food prices. And when we talk about food prices, I think this is the last statistic here I want to just think about. Recently, we did the province did an updated costing of the quote unquote nutritious food baskets, measure of how much it would cost a family of four to eat a diet in line with Canada's food guide. So if you were living on income support and you wanted to eat that basket, you'd have to spend 93% of your check on food every month. So it's obviously not feasible, but this is I think a good example of how right now we have created food insecurity by design in this province and in other provinces in Canada. There's no world in which you can set things up the way we have and not expect huge food insecurity rates at the other end and all the attendant consequences. So I think this is all maybe the kind of context for where we are as a province right now. I'll stop sharing my slides and we can spend the rest of the time chatting.
Perfect. Yeah, I mean, I think those certainly some really impactful numbers that you provided there, and provide, like you said, a really good context to further conversation. And hopefully we'll have some questions from the audience as well. But maybe first, we kind of jumped into the topic, but what is the role of you at Food First NL around food security in the province?
Sure, yeah. Quickly put, we're a connector. So our organization, we've been on the go for more than 20 years. A big part of what we do is network and connect all the folks who are working on food from any angle. So that includes folks within the food charity space, folks in the food production space, folks in the advocacy space. Connecting them to each other is a big part of what we do. So there's a lot of work happening at the very grassroots level on food. And so as a provincial network, we're able to connect folks to each other and connect them to resources. Then there's another chunk of work we do around advocacy, and this has become a much more important part of our work in recent years, I think, which is that, we know a lot these days, not us at Food First, but all of us in general know lots about what are the root causes of these things. And so advocacy on policy solutions for those root causes is a very important part of our work. Then there's a third bucket of on-the-ground programs. So we operate ground-level programs that are meant to maybe push boundaries a little bit on what responding to food insecurity and supporting food security can look like. So in St. John's, for example, we operate a mobile food market that provides more affordable fresh produce at the neighborhood level. Things like that is the third kind of big part of our work. So we have team members across the province working on these things, but it's largely about supporting collective action on some of these big pieces.
Excellent. Well, you are a busy group of people, it sounds like. Well, that's excellent. So I guess, that provides you with a lot of knowledge around this area. And I'm wondering, based on your work, what you would say the key factors are to really make a difference in food insecurity rates.
Yeah, so I mean, there is really one key factor, and it's income, right? Like when we're talking about food insecurity, the vast majority of the problem is just that people don't have enough money to buy the food that they need. And I think it's important not to dial in this conversation just on social assistance rates. I mean, social assistance is one of the places where we have the most, I think, moral responsibility. We elect governments that set those rates and have put people in poverty by design. But we also want to talk about what are minimum wage rates looking like, right? So the minimum wage in this province is way below any living wage. And so, we are also setting up folks in the labor market for food insecurity, right? And so that's another bucket here. So I think there are a range of interventions on income, right? Raising social assistance, connecting it to income, to inflation so people don't lose ground every year, raising the minimum wage to or above a living wage number. And then the policy intervention that our organization works a lot towards, and many folks in the food security space do, is basic income, where folks would have a more universal income safety net under them, an income floor that you couldn't fall below. Because right now we also see a lot of people who fall through the cracks between the different pathways to support to financial support. I would say there are dimensions to food insecurity that go beyond income, and in our province, the one that does get some attention from us and from others is around transportation. And so there are folks in this province who, and they're intimately connected, of course, right? Because every dollar you spend on a $30 round trip to the grocery store by cab in St. John's because the bus doesn't work for you, that's a dollar that you're not spending on food. So there's a direct connection there. And then we do a fair amount of work on the ground in rural communities and small communities where folks who don't have access to a vehicle often just don't have access to the diet that they would like to eat, right? So unless you have access to someone else with a vehicle, it can be really challenging. Even if you have the finances to purchase that food, the logistics are not always there. And so there is a kind of a conversation about transportation and about how we plan our communities that connects here. And some of that's just about not forcing people to spend money out of their food budgets on moving around. But some of it is also about there are some places where some diets are just not possible in this province. And so there is some independent challenge with transportation as well.
Yeah, and certainly kind of, I think, maybe a more unique challenge in this province in particular, just being so geographically broad. I think, you provided lots of nuance there, but I think this is a great opportunity to bring Catherine in as well, because certainly the lived experience, the advocacy element is important here. So Catherine, from your perspective, what would you say the key issues are for people in experiencing or who are potentially at risk of food insecurity?
I think it's affordability, accessibility, and stigma. There's a lot of stigma around getting help. Just the word charity itself sometimes promotes that stigma because people don't want to be considered a charity case per se. Um, you know, people want to have a sense of pride, independence, and dignity. And when that's lost, that's huge. And accessibility, as Josh already touched on, transportation, and the Metrobus and the Go Bus passes that the initiative by the government right now for persons with disabilities and seniors and young people is excellent. It does provide more access, but there's still a ways to go in accessing food, especially local healthy food. Because what's happening is that if you can only get to a grocery store and you can't afford fruits and vegetables and proteins, which are the highest right now, then you're just going to get what you can and what you can afford, where you can get it. So to me and to the people I connect with, those are three biggest issues. Affordability for, like Josh said, again, it's for everyone, not just people on assistance, but it's for, people that are working are struggling. And oftentimes for various reasons, people don't have access to places that provide meals. And, if you look at the organizations that provide daily or weekly meals, and in addition to the food banks, that's great. But these things should be options for people that are not common, and it should not be regularly needed in their lives.
Yeah, okay. Well, certainly, I think what's really stood out to me from what you said was the piece around dignity, that, people who are at risk of or living with food insecurity, they should be allowed to feel dignified in how they're living. And one of the recommendations that Josh had mentioned around the basic income sounds like that's maybe really a piece to that puzzle, where we collectively believe that everyone should, be able to have a certain amount of money to be able to lead a dignified life and make choices about their food and their health. So I'd love to dive into a little bit more about that, but first I want to jump over to Robert just to see if we've got any audience questions yet.
We do. We got a few questions.
Okay.
So the first one is from Chelsea, and this can be addressed to Catherine or Josh. Has anyone looked at the number of people seeking food donations through informal groups, like the Neighbors in Need group on Facebook, to add to the measure of food insecurity or numbers availing of food charity?
I can take that one a little bit with a kind of unsatisfying answer. Not much. The closest that we've got for local data on this would be, we just did a process called Rethinking Food Charity, which was focused on kind of re-envisioning how that support system works. And we did do some pretty extensive surveying of folks who are food insecure about where they were accessing food. And so within those surveys, we have a bit of data on how often people were accessing those types of programs, the more informal kind of mutual aid things. I'm not sure it would be representative. Like it's not strong enough data to extrapolate from at the provincial scale. So there's a little bit, but in general, we don't know that much about this because there are a lot of those things happening at that small scale. And I think in general, one of the things that we did really see maybe shown a little bit more prominently during the pandemic, during the lockdown periods of the pandemic, was how many of these kind of smaller less formalized food supports people were accessing. So like seniors who were going out to a social night at a 50 plus club and getting a soup and a sandwich with a card game, and we're integrating that into how they were planning their meals, right? And so there are a lot of these kind of, they're not really food programs, but they are ways that people are using the support networks to access food. But there's not great data on it, is to answer that question succinctly.
If I can just jump in there, I think that getting data from those sources would be very, very difficult for a number of reasons. One is because there are so many sources of informal support, like Josh just said about, social groups or whatever. I know people sometimes that it's a routine to visit a flea market on Sundays, not just, not to buy things there, but to get a cup of coffee and a Towton or whatever. So that's a part of their routine and informal support. Also, there's the anonymity around it as well, that either group leaders don't want to give out their numbers out of respect for people, and people don't want to be included. So getting those stats would be very difficult to do. But we do know what's happening on a very high scale. We do know that there's people on places like Facebook, not just in one group, but just among friends saying, I know somebody who has no food, a family that needs help. Can we get together and help? So, yeah, there's no real data per se, but we do know it's there.
So I got a couple questions from Prasanna. So this it refers back to your presentation, Josh. So the first question is there any chance to get provincial specific stats for other provinces in Canada from any source?
Yeah, there's plenty. I'll pop a link in the chat there for this call to Proof, which is the institute that gather these statistics. I'll pop a stat into their quick summary right there. So yes.
Perfect, and perhaps we can provide that link to viewers after. And so this goes back to your stats.
Real quick, to say we've got a list of resources at the end, and Proof is on the list, so you'll have it.
Okay, perfect. Thanks, Kathleen. So we got one more question from Prasanna. What would be the policy solutions for these alarming statistics?
Yeah, and maybe this is to segue back, Kathleen, to the conversation around basic income, right? Like, I think we sometimes risk overcomplicating the solution here. I get a bit frustrated because sometimes people call me and they say, what can we do about food insecurity other than give people more money? And I find that a really annoying question. That's like saying, what can we do about thirst other than give someone a drink, and we wouldn't ask that, right? So it really does. This is actually one of those places where we have lots of evidence about the one intervention that's proven to work, which is getting more money into the hands of folks who need it. And so I think one thing to highlight, though, is that this province is among the leaders in considering basic income as a policy option. So basic income was a key recommendation that came out of the Health Accord, which is no surprise, right? When we talk about how to fix health in this province, the Health Accord is very clear that we can never fix it through the healthcare system. It means fixing the determinants of health. Income is primary there. And so there's two very strong basic income recommendations in the Health Accord. We also now have an all-party committee of MHAs studying the concept of basic income. As part of a group of citizen and community advocates, I've met with them, and it was a very encouraging conversation. We have a neighboring province, PEI, where has already achieved all-party consensus on basic income. Their premier is now writing letters jointly signed by all their opposition parties asking the federal government to come to the table around implementation of a basic income in PEI. So I think we know that basic income has super majority support when you poll on it, that Atlantic Canadians are even more supportive of basic income than any other part of this country, and that it has like really moved in the last 2 or 3 years, especially from slightly wild concept to considered policy option. You know, it's being costed, the mechanics are being worked on. And so I think that's one thing just to highlight here is that a basic income is more real than it ever has been as a policy option. That's not to say basic income isn't the only way to get people more money into folks' pockets. I think, you know, we can talk about things like increasing social assistance rates, bringing the minimum wage to a more livable level there, and those things are complementary, particularly living wage, right? Now, so for every dollar more that the minimum wage goes up, that will reduce the cost of a basic income floor, right? Because fewer people are going to be relying on the income guarantee if their wages are enough to get them over that level. Whereas right now, many folks who are working full time for minimum wage would still be under the floor that a basic income would be creating, right? So there's a few different pathways here, but it really does, as a policy problem, this is actually in some ways one of the simpler ones that we have to deal with. You know, there are a lot of other really tangly ones, but household food insecurity, I mean, I have to say to people just like, let's try giving everyone the money that they need. And if that doesn't work, come back to me, right? But until we've tried the obvious solution, you know, I'm not sure that there's that much need to fuss with other ones.
Excellent.
If I can chime in here on policy just for a second.
Yeah.
Yeah, like, and there's steps that can be taken fairly quickly too when it comes to policy and food insecurity. For example, and Josh and I had this conversation a couple of weeks ago. For example, on income support, yes, basic income, but also for people that qualify under the community long-term care programs, there's a food allowance for special diets. Because one of the things that often that people can't avail of are special diets, whether it's at a food bank or at one of the places where you can get meals. So if you have to have a gluten-free diet or a diabetic diet, a sugar-free diet, things like that, and other things, you know, the cost of food has gone up. So those types of foods has gone up even more because it was fairly affordable before. So now it's gone up even more. And the Eastern Health, under that program, provides a food allowance to people. And it's not just for people on income support, it's anyone who qualifies for that program. So if you're under that program and you get the food allowance, I mean, I think the food allowance is like $30 or $60 a month, all right, for that special diet, and that's not cutting it. So policy, and I think one of the problems when it comes to policy in any area is the idea that it's just words on paper, but it's not. It's not just a policy written on paper. It affects people's lives. And that's what we need to remember every single time that there's a policy being made around food insecurity, security, and other issues, is that they are decisions and practices that they're guided by that policy that affects people's lives.
Well, Catherine, that segues really nicely into a question I wanted to ask you. So Josh mentioned the all-party committee. And so I'm curious kind of where the voice of lived experience plays into policy making, committees like this all-party committee on basic income. You know, where does that fit into those types of that work? And in your experience, do you feel like that is typically being included?
It's a really good question. And well, it's a complicated answer. It's yes and no. Persons with lived experience the voices are being included separately from the table, let's say, more so than being at the table. So I've been involved with consultations with on the health accord, you know, directly and as a group, representative of organizations. I have had ministers have had consulted with me around things like food insecurity, called me up or I met with them, and others that I know of have been involved in that way. But are we actually at the table for every meeting? Or do they rely on organizations that supposedly, quote unquote, quote, represent people with lived experience? Because there's a big difference. There's a huge difference, and Josh, you probably will agree with me on this one. There's a huge difference between somebody who represents people with lived experience and people with lived experience. And it's very important that people with lived experience are not just consulted, all right, or have an opportunity to give their voice, but to be actually at that table each and every time and being included in the process from start to end. I hope that answers your question.
Well, like you said, it's a nuanced response, but I think that you provided some good insight into that nuance. So thank you for that. Maybe I'll just pop back over to Robert and see if we have any more audience questions before I keep blasting through all of I could ask you questions all day.
Yeah, sure. So I can ask a question from Barry here. And I'm just kind of paraphrasing from what he's trying to say, is that basically just trying to kind of harvest some of our local resources within Newfoundland and Labrador. So is there anything that perhaps the federal government can do in helping harvesters such as fishermen perhaps fish all year long so that they can supply local resources to the population of Newfoundland and Labrador?
Can I start with that one, Josh?
Yeah, go for it.
Okay. I'll just be very brief and then you can pick up if you want. There's a role for all levels of government in this. And when it comes to fishing and farming and agriculture and other ways of getting food, all governments, like, to us, well, people with lived experience, I guess, is tricky because we feel like, okay, instead of giving so much money, let's say, into oil and gas, all right, a very big common one, controversial at that, give more money to people, to fishers, allow more fish to be caught, allow more licenses, give more money into agriculture, give more money into cattle farms like we used to have back in, 60s, 70s, and 80s. Yeah, I'm sorry, I guess that's given my age, but, money should be put in, maybe money being put into those things will help for us to be more efficient and also to be more affordable, because as we know, it's not affordable at this point, and we're shipping out more than what we're using at home, and that's an issue. So I know that's a very, very simplistic way of looking at it, and I know Josh can add a lot more complicity to that. So go ahead, Josh.
Thanks for the tee up. No, I think that's a really good way of framing it. I think on accessing wild foods is one thing to mention is that this is not disconnected from the income conversation, right? So one of the things that we see a lot of is that the cost of accessing wild foods is becoming prohibitive, right? So, for someone living, for example, in North Coast of Labrador, you're looking at the cost of fuel for your snowmobile. You're looking at the cost of ammo, things like that. And those have all gone up pretty sharply. And so the costs of accessing the land to harvest from it, which is very important for large populations in this province in particular. We have the highest rate of wild food utilization of any province in the country. but those costs are financial primarily, right? Like, and we do see a lot of barriers coming up in terms of wild food access. I'll say right off the hop also, like our organization, we are not fisheries experts. The regulatory environment around the fishery is complex and tied up in lots of international agreements in terms of the balance between, how much of our fishery is devoted to local access versus, commercial exploitation, right? But I think that does have a place in this conversation. One last thing, I just want to thinking about what you were saying, Catherine, before about the place of lived experience in this conversation. My read on it as like from the organizational side, I would say, and you can let me know if this is wrong. I think things have gotten better in terms of consultation in the last number of years, but they have not gotten towards accountability, right? So people with lived experience right now, where things are generally is that upfront, when a new idea or policy or program or whatever is being developed, it's pretty reliable these days that there will be consultation. It'll be better than it used to be. There's more money put aside to reduce barriers to access. So it's more common to see, say, childcare subsidies, honoraria, the kind of building blocks of good consultation for folks with low income. What we don't see a lot of is accountability to that community after. So, you don't see a lot of examples of policymakers coming back to low income folks saying, here's what we did with your feedback, and here's how the policy changed, right? And there are not a lot of forums for that to happen. So like in our organization, that's one of the reasons we're actually just building out a lived experience advisory group ourselves that's meant to be long term. And that's actually one of the things we were thinking about, is to create a space where some people can keep track of this stuff. Because I think that's one thing that lived experience engagement, actually some of the most powerful versions of that I've seen, has been when a decision maker has been brought into one of those accountability situations and asked, why did you do this thing that impacted my family in this way? That is the thing that is less common in kind of engagement processes, right? We should be coming back to and doing report cards on the health accord and things like that in the years to come, and having that reflection, but we don't always build those structures. So I just wanted to flag that, because I think that's kind of where we are on the lived experience piece. It's definitely world's different even than when I started doing community work, but it's only halfway there.
I think that's a really interesting piece that you added, and to me, what jumps out for that is kind of building trust with communities. So if you ask and then you go away and then you never come back, where's the trust in sharing the lived experience the next time you come to ask for input and advice? Robert, how are we doing for more questions?
Good. We got, perhaps we'll just take one more before moving on. And we got a very timely question here, Josh and Catherine, with the stretch of cold weather, is do you think there's a role for technology to supplement the growing season here in Newfoundland and Labrador?
I could start, Catherine, if you want, and you probably have some thoughts on this too. I think when we're talking about, this is one of those places where it's useful to distinguish between food security and food insecurity in the conversation, right? And food self-sufficiency. So I think those kind of technological solutions absolutely play a role in food self-sufficiency. I think when we think about food security in the broad sense of do you have access to the diet that makes sense and that you want to eat? And for many of us, that would include, better quality, fresh foods. That the sort of investment in those kind of all season growing technologies does make a difference. Where it's less clear is around the relationship with food insecurity and with food prices, right? Are those interventions, are those technologies that can bring some of these products to folks more affordably or not? Is kind of the question for me in the food insecurity conversation, because that's not always true, but we have seen examples where it is cheaper to buy, say, a locally grown hydroponic lettuce than it would be to buy something in the store, and the store things don't last as long. So there's nuance to this, but I would say that's what I look for here from a food insecurity lens is, are those bringing food to people more affordably and accessibly, and so that's kind of, you want to look case by case to see how they work. But then in a broader sense, they have a big role to play in having a more healthy food system writ large.
Yeah, so more nuance to everything here in this conversation.
Sorry.
No, it's I think it's important to add to the conversation, because sometimes we just have a little snippet, like that iceberg analogy you had. We just understand a little piece of it and we don't realize it's so much bigger. Catherine, did you want to add anything to that piece?
No, I think Josh covered that, and technology is not my forte. So, I'm open to conversations about it, and of course I'm a part of it, but in regards to offering anything, I think I'll pass on this one.
Okay, no problem. Well, what I'm really interested in, kind of switching gears a little bit, but we kind of talk about that definition of food security, and we see the reference to diet quality and quantity there. And sometimes in this space, when we talk about diet quality, we sometimes talk about education and the role of education in that. And I'm curious, maybe I'll start with you, Catherine, for this, on what your thoughts are around kind of the education piece for diet quality.
I myself, and again, the people that I connect with, when we talk about that, we often acknowledge that there is a role to play for education. There's a place for it. Education is always important in every level of life and everything that issue we deal with. So it has its place, but a lot of people, I'm not sure if you've heard it put this way before, but a lot of people are feeling like educated to death. Like, there's been an overabundance of education to the point that people are starting to feel, or people with lived experience anyway, are starting to feel preached at, like it's their fault, and it just makes them, and it just provides more barriers to access to affordable and healthy foods, because they do feel like, well, I can't ask for help because according to the education, it's my own fault. I chose that bottle of pop last week over milk because I didn't have enough money for the milk. So that, they're, like I said, they're feeling like it's their fault for not choosing milk. So there's definitely a place there for it, but it's not education that is needed so much now as, like Josh said and I said earlier, it's affordability and accessibility and doing away with the stigma related to getting help. People know what's healthy. I think that's been, again, just ingrained in us right now. It's been preached to death. So people know what's healthy. People know that for the most part, depending on any special diets, your fruits and vegetables, your proteins, those kinds of foods are healthier, but it's affordability and accessibility and not education that's needed. Josh?
Thank you. Yeah.
Yeah, I'd echo that. I think, there is definitely space when people express a desire to learn more about how to do things with food, how to cook, how to prepare, how to budget. That's absolutely something that we should be supporting. And there's lots of options out there. I get very squirmy when that's presented as a solution here, though, for a bunch of reasons, right? I think we have a long history of patronizing folks who are living with low income, right? And this really plays into some stereotypes we have as a society over why people might be living with low income, that they're just not making the right choices, not planning, not budgeting well enough. And I don't think that's a very helpful discourse here, right? The other thing is, a lot of the kind of educational offerings involve access to material conditions that are not realistic for people. So, if you go to a cooking class and get taught how to cook really well on a budget, and then you're living in a single room occupancy building and don't have access to a kitchen or a fridge, does that leave you in a better place with your food security? No, it doesn't. And so I think like, not to dismiss that whole area, because it's people justifiably are often looking for more knowledge about food and how food fits into their lives. But I don't think it's something that you can frame as an intervention that meaningfully reduces food insecurity. And so there's and I think also like sometimes people risk conflating the social value of those kind of activities. So like people often really enjoy connecting around food and food-based programming, but that is also about connecting with other people in a meaningful way, right? Like it's not necessarily about learning to cook soup for 50 cents. It might be about like spending some time with the folks in your community. And so that's a different intervention that also has value. But again, I wouldn't want to see it framed as an intervention that addresses kind of the systemic issue here.
Yeah,
No,
okay.
and Nancy, just to add to that, Josh, was you made a good point about the rooms and people not having their own access to fridge or kitchen, but also for people that have apartments. Like I know one of the things that I've heard a lot during COVID, and when inflation really got bad, was that education and educators, I should say, are promoting cooking in bulk, buying in bulk, cooking in bulk. It's cheaper. Get frozen vegetables instead of canned vegetables or whatever because it's cheaper. It goes further. That's all great. First of all, you just still need to be able to afford that, and it still comes back to that. But secondly, you have to have space. Like, I know for myself, speaking with lived experience, I'd love to make a pot of soup. I could eat, homemade soup for breakfast, dinner, and supper, and I'd be fine. But if I make a pot of soup, and store it, like educators say, I have nowhere to store it. My apartment size fridge with the freezer just don't cut it. I don't have the room for it. And buying in bulk is great, but if you can afford it. But then again, it's even cupboard space. I mean, you look at the bachelor apartments now, and small apartments are getting smaller and smaller, and space is becoming smaller and smaller. So that's not necessarily a good thing. And again, we don't want to take away from the fact that, oh, well, here's all your solutions. No, it's not, because you still need to have the income to be able to pick up the things to cook in bulk. So that's an example.
Yeah, and very helpful to have that sort of on the ground lived experience example to for us. I'm just watching the time here, mindful that we're getting close to the end. But I'm hoping we can maybe squeeze in maybe one or two more questions, depending on how quickly we can get those out. So Josh, you mentioned at the beginning around the children in Canada living in households that are food insecure. And I'm wondering if you could speak to a role or not, what your thoughts are around school lunch programs in addressing that.
Yeah, good question. Because there's a lot happening around school food programs right now in the country. Just to contextualize for folks, I'm not sure everyone's aware of this, but Canada is almost uniquely bad among high-income countries in terms of our school food landscape. So the vast majority of OECD countries have some kind of universal school food program. We don't. It's very patchy across this country. Many children don't have access to it. Things do seem to be shifting. There is now a national school food policy being developed. One hopes that there will be federal dollars attached to that that will flow to expand school food programs, because so in this province, for example, every school has a breakfast program, but only a few, mostly in Metro, have the School Lunch Association, which is the pay what you can model for school lunch. And so we have seen provinces expanded on their own. PEI launched a universal school lunch program 2 years ago now. They just went for it. They didn't wait for the feds. So there is movement happening here. And it certainly makes a difference in children's lives and children's ability to engage with school. Where the data does not support is long-term impacts on household food insecurity, right? So like just the reality of it is that this intervention is not big enough and it's not enough of an impact on household budgets to kind of budge people out of overall household food insecurity. That's not a reason not to do school food, I would say. Like our organization is involved in national advocacy around this because we see value in school food programs, both in terms of what it looks like for children in class and their ability to engage with school and connections to the food system. But I would be very cautious about looking at them as a solution systemically for food insecurity, so and that's maybe the distinction to make here.
Okay, yeah. So has value, but not necessarily the solution to the broader issue.
I could have said that and saved you a couple minutes.
But if I can just, I'll just say one thing about that. Up until, well, when the school was closed, I was a volunteer with the school lunch program, the school meal program, for breakfast and stuff like that. So I got to interact with a lot of the kids and stuff. And it all still comes back to choice. The programs are great. The kids loved it because they got together with their friends before class started and kind of like, just built that camaraderie there and stuff like that. It helped them concentrate better, and to work better in school. That was their feedback. But again, it just comes down to the the need for food security and the need to feel that the breakfast or lunch in schools need to be an option, not a need. And again, I want to stress that because it's so important that, again, they're not solutions like Josh keeps saying, and that they should be options and something that people want to avail of for whatever reason, not because they need to avail of it. Thanks.
Okay, so I'm hearing a theme here of that kind of going back to that dignity, the choice. So not forcing people into one solution, but giving enough ability for people to be able to kind of decide how they're living their lives. So I'm going to ask one more question, if you guys are okay to maybe hang on for a couple extra minutes, and then I'll pass it back over to Robert. So the last question I wanted to ask was around the healthcare and the judicial systems. So do they potentially have a role to play in food security? We know that our institutions have food systems, so our prisons, hospitals, long-term care facilities. So they're providing food, kind of the sole food source for people when they're in those institutions. So how does that, or does it have a kind of a tie-in into food security?
There's a couple of
If I
angles
can
to this.
just
Catherine, you want to go first?
comment on that?
Yeah.
Yeah, just to make a comment, because I know you'll have a lot more insight to give on that one. On the ground, okay, unfortunately, we have individuals, people who say they go back to prison because they get their meals and they get a warm place to stay. So they get a bed and meals. And that's sad. But there are actually a large number of people who do that. I really wanted to get that point out there, but so Josh, take over, please.
No, that's a really important point, right? And we're seeing more and more of that. Like we're in, I would say, the worst homelessness crisis that I've known in the province right now. And there are definitely folks who, are looking to, unfortunately, that lockup is the best option to access a secure, warm place to sleep and place to eat. So that's a real thing. Happens every day. I think on the institutional question, there's a couple of ways this connects, right? So one is our healthcare system, just like from a kind of top level thing is the biggest single thing that we spend money on in this province by far, right? And so when we think about how that money is being spent, I think one of the things that the health accord is pushing us towards doing, and you'll hear, for example, I think in the recent negotiations around federal provincial health transfers, one thing that the premier said was that we would be looking for more conversation about social determinants of health within those transfers, right? Because that money pays for our health system, but doesn't generally pay for social supports, right? But those social supports are what determines health. And so, like, there's a question to me here at that top systems level about connecting some of the bigger systemic changes around income to our system of health and social transfers and to how the federal and provincial governments interact. So that's one big one. The other piece that I think connects here in terms of the food insecurity side is that our health system has a huge footprint on the ground, right? There are health facilities present in so many communities. There's a logistical footprint to the health system. The health system can be a real platform for interventions that, again, not a substitute for those kind of system level changes to income supports, but there are interventions that happen through the healthcare system. So there's a lot of national attention right now on social prescribing or food prescribing, where there would be food subsidies being offered as a healthcare cost, right? Where there's a health consequence identified. There's some complicated ethics about that. We could talk about that for hours, but that is one place where the healthcare system connects directly to sort of the reduction of food insecurity at a household level. And then on the productive side and on the sort of food self-sufficiency conversation and the food systems conversation, those institutional buyers, almost everything that's served in those institutions it comes from out of province, right? And so one thing that our organization does a fair bit of work on is trying to bridge that gap and connect and support a more localized food system within those institutions that then can support a more thriving local productive food system. And that's beneficial to the folks who are within those institutions who get access to food that's the food that they would want to eat. But it also helps support a more economically healthy food production sector. And that is, I think, objectively a good thing, but also can have some implications in terms of food price and availability that plays out beyond the boundaries of those institutions. They're just such big buyers that they have a real impact on the whole productive and logistics ecosystem around food in the province. And so working with those big buyers can have a lot of impacts down the line.
Yeah, certainly from what I've heard, it allows farmers to plan. So if they know they've got this big chunk of money that's allocated to them, they can plan better. So that's great. Anyway, we could talk about this all day, but I'm gonna keep it together and hand it back to Robert to wrap us up here.
Sure. So I'm just going to take one more question from the audience, Josh and Catherine, before we conclude up. Has there been any discussions around Northern Allowance for all residents of Newfoundland and Labrador in terms of options to assist with mitigating the high costs of food and transportation costs?
So if you live on the north coast of Labrador, yes, there's Nutrition North, which is the federal subsidy program that does theoretically lower food costs across the north. This is another place you could talk for a day because there's a lot of mixed feelings about the impact of Nutrition North on what people are seeing on the ground. For example, if you live in Nunatsiavut, about whether those subsidies are passed on to the consumer in the way that it was designed. And I think there's some but that program exists in the context of Northern Labrador, but there's no equivalent for, if the question is, is there a similar kind of subsidy or support program for the whole province as a relatively remote place? The answer would be no. No, there's nothing beyond the north. And even I think as a matter of kind of cross-northern equity, you do hear from folks in Labrador that some of the cost of living supports that are available to people living elsewhere in northern Canada are not available to Labradorians, and so there's some challenges there. Is Labrador regarded as north enough? But no, not for the rest of the province. I don't think that's likely.
Okay, so I'm gonna kind of conclude this and wrap it up. I just want to be mindful of people's time right now during the lunch hour, perhaps for most. Um, so that concludes the time we have for today's session. I want to thank Josh, Catherine, and Kathleen for leading us through a really great discussion on food insecurity in Newfoundland and Labrador. We have put together a small list of resources on the topic, including where you can learn more about food insecurity, how to access assistance, and how to volunteer or donate. Melissa will put that in the chat right now, and it will be included in a follow-up email you'll receive shortly. So a big thank you to everyone who joined us online to listen and participate in our discussion. Just a reminder that this recording of the session will be on YouTube, on our YouTube channel in the coming days. And our next session will take place on March 28th. And our topic will be how our oral health impacts our overall health. So stay tuned as the details of that session will be released soon. And lastly, you'll see a very short event survey on your screen after we end this webinar. We'd appreciate you providing any feedback or ideas for future healthy discussions. So thank you, everyone, and have a great day.
Thanks.
Bye.
Okay.